President recognizes Senator Colbeck.
Thank you very much, Madam President. In today's society, it's pretty easy to find topics that divide people, but it's much more difficult to find topics that unite. But I'm happy to report that I found one: direct primary care services. Many of you are aware of my years of advocacy on behalf of direct primary care services. Direct primary care can save over 20% on total health care costs, provide Medicaid enrollees with better access to primary care physicians, and improve the overall quality of care via preventive care. I've been working with physicians who are free market advocates in Michigan across the nation to expand the availability of direct primary care service model to all Michigan residents, including those unable to afford private insurance. A couple of months ago, one of these physicians, Dr. Chad Savage, participated in a forum hosted by the Grand Rapids United Progressives. Yep, you heard me right. A free market healthcare advocate and progressive healthcare advocates participating in the same forum. Do you know what was even more amazing than that? They found common ground. And what was that common ground? They both applauded the importance of direct primary care services in our healthcare system. Do you know where else there is agreement on the importance of direct primary care services? Our federal government. In an environment where it's been difficult to find agreement on any policy regarding health care, direct primary care is the exception. In fact, President Trump's budget proposal features a direct primary care Medicaid initiative and $100 billion in funding for stability and innovation grants to states. Thanks to the support of many of my colleagues in this body and the body across the hall, Michigan just so happens to have an innovative DPCS Medicaid pilot that should help stabilize our out-of-control Medicaid spending. In other words, the DPCS Medicaid pilot passed by the House and Senate is an ideal candidate for these federal grants. In order to truly take advantage of this newfound appreciation for state-based innovations and provide long-term stability for programs such as Medicaid, it is important to provide states like Michigan with long-term flexibility on how to best address the health care needs of our citizens. Our current Medicaid funding assistance from the federal government comes with a lot of strings. As of February 23, 2017, there were 1,337 rules, 1,130 proposed rules in the queue, and 3,377 notices for state Medicaid authorities to abide by. These strings significantly impair the ability of states to innovate. One of these hidden strings is a barrier to getting reimbursement for patients using direct primary care services from doctors from the Centers for Medicare and Medicaid Services, or CMS. So how can we cut this string? By issuing Medicaid block grants to states free of regulatory strings. However, we need to be careful with the term block grants, as not all block grants are the same. One version of block grants is referred to as a per capita block grant. Per capita block grants would appropriate a flat, capitated amount per Medicaid enrollee to the state. Per capita block grants are a bad idea because they incentivize states to add more people to the Medicaid rolls. How do they do that? Well, at an FMAP rate of around 65%, the state would receive roughly $2 from the federal government for every $1 of state funding. By encouraging states to seek free federal money by growing their Medicaid rolls, this approach does not stabilize Medicaid spending at the state or at the federal level. Another version of block grants is referred to as the lump sum block grant. Under this approach, states would receive a block grant of Medicaid funds equal to the previous year plus some inflationary adjustment. Under this type of Medicaid block grant, Michigan would receive roughly $12 billion each year without the federal strings. This approach incentivizes states to find ways to decrease the number of Medicaid enrollees, either by promoting employment of Medicaid-eligible citizens in good-paying jobs, or by lowering the cost of health care so that less people need financial assistance. Success would be measured on the basis of the number of Medicaid enrollees who no longer need government assistance. Furthermore, lump sum block grants would restrain the growth in federal Medicaid liabilities. Now, if Michigan were to receive lump sum Medicaid block grants from the federal government, direct primary care could help save taxpayers in excess of $3.5 billion per year while providing all 2.4 million Medicaid enrollees with better care. No wonder there is common ground on direct primary care for both progressives and free market advocates such as myself. I'd like my remarks added to the journal, please.
Senator Colbeck requests his remarks to be put in the journal without objection. So ordered.